So the understanding that obesity is a disease also comes from the fact that it is now understood that the brains of some people, not all, are wired differently. Their cravings are real. There is a food noise that happens in people's heads.
A good diet, a healthy relationship with food can change so many things in your life.
We've all been hearing of the word Ozempic. For me, it's still a fairly mythical magic molecule. You know, I would love to know all about it. I know friends who've tried it with differing and varied results. But it's again a cultural phenomenon that really requires good evidence-backed knowledge so that you can take reasoned choices, not just from the WhatsApp universities that we all now subscribe to. So we are very delighted to have with us today two wonderful nutritional professionals. One is a very reputed endocrinologist, Ambrish Mithal, who's written a book on the weight loss revolution and everything you need to know about Ozempic. And we also have a nutritionist who's lost 45 kilos herself, Richa Gangani, by using a completely different method, a natural method, brought down across generations, which is about a different kind of mind control. So we're going to have both of them on stage, and we'll come to the kind of final truth about how we should have a relationship with our own body, our health, and our weight. So ladies and gentlemen, please welcome on stage Ambrish Mithal and Richa Gangani. Thank you so much. Pleasure to have you here. Yes, I think so. I'm just going to ask my colleagues. Hi. Yes. Aishwarya, if we have Ambrish's book here, can we just have it on stage? He wanted to use this opportunity well, Come, please sit. Oh, should we just, I'll just push this out a bit. Yeah, thank you so much. So Ambrish, I'm going to start with you. Thank you so much for being here. As I said, Ozempic is now literally the sort of new catchword for everybody. So first of all, before we go into everything we need to know about the molecule and the drug, I want you to first define obesity. What is obesity and what is the threshold beyond which you're not just being lazy and fat, but it's obesity in itself, or obesity.
So thank you for having me here. I've been to Chennai many times, but it's always for medical meetings, and I have many friends here, but I don't think I have any non-doctor friends. So it's the first time I'm meeting all of you. Very happy to be here. So I think the definition of obesity is important because all it means is excess fat in the body. So fat that is in excess of what is required by the body, that is the definition of obesity. Now, practically speaking, it's measured in many ways. But the fundamental thing is that obesity is now regarded as a disease, as a condition, at least as a condition. The WHO way back in 1997 classified obesity as a disease. The American Association of Clinical Endocrinologists calls it ABCD because of the stigma associated with the word obesity, adiposity-based chronic disease. So if you were to ask me why is obesity important, what is obesity? When excess fat causes disease in the body, and if you ask me again, based on all the science available, obesity is the mother of all non-communicable diseases. Modern non-communicable diseases, let's start naming them. Diabetes, you all know very well. Hypertension, you know. Heart disease, you know. Some kinds of cognitive dysfunction. Renal disease, that's the metabolic part. If you look at joints, osteoarthritis, and many people are refused surgeries by their orthopedic surgeon, go and lose weight first and then come back. So a whole gamut of musculoskeletal problems. And then, of course, there are even cancers that are increased by obesity. So obesity, for the public sometimes, for the non-medical fraternity, obesity is a cosmetic issue. Everyone's trying to lose weight and look good. For the medical community, at least the endocrinologists, obesity is a condition that requires treatment.
So, that's a good definition, but the phrase that you used was any excess fat in the body. And now we have such an irritable relationship with ourselves because there is no unless you're sort of body zero, any sort of fat on your body, you're kind of irritable with yourself all the time. You may not do anything about it, but it's changed. So when you say excess fat, is there any acceptable formula for what is excess fat?
Sure. So the most widely used formula is the traditional body mass index, which is the relationship of your height to your weight. If your BMI is more than 30, for example, you're clearly classified as obese. If your BMI falls between 27 and 30, you would be called overweight. Between 25 and 30, you would be called overweight. The problem here is that BMI is just total weight and height. BMI does not take into account the distribution of fat. So while BMI continues to be a popular definition because of its use in public health, it's not the most accurate definition. So why is it important for us to know that? Because Indians, for example, are not as obese as Western Caucasians are, as Americans are. Yet, we have a greater amount of fat in our bodies, particularly in the wrong places. So what is important to understand is all fat is not the same. Yes, all fat is not the same. It is the fat around the organs, around the viscera, within our tummies, that is the dangerous fat. That secretes a lot of chemicals and toxins, and it's the bad fat. Okay, fat on your upper arms or thighs is not that bad. Therefore, the definition itself is a challenge. We do use BMI, but we use lower BMI cutoffs for Indians. For example, if you say above 25 is abnormal or overweight for Americans, above 23 may be the case for Indians. And above 25, the Endocrine Society, of which I am a member or was a president, suggests that India should be labeled as obese, which means that many of us in this room would actually qualify to be called obese. Okay. So that is true. I mean, that's how it is. The reason is not because of cosmetics. The reason is because even at a BMI of 25, Indians have larger amounts of internal fat that can damage their organs, as we described.
I'm trying to scrunch my body as much as possible on stage. Richa, I want to come to you. It's absolutely impossible to think of you being 45 kilos more than what you are right now. It's really hard to understand. And before, as I said, we dive into the craze for the chemical now and the medicine, you approached it completely differently. What was that? And when did you decide that 45 kilos over much is too much? And what was the methods you used to come down?
So I was 105 kilos when I was 13. So
would you just speak into the mic?
Sorry. So I was 105 when I was 13, like a teenager girl. But that time, doctors suggested some tests, and I consulted an endocrinologist. So I was diagnosed with hypothyroidism. So I was asked to take 150 mcg tablet. And that time, the social media was not a thing. We were told this, just take these medicines, take these things to lose weight. And obviously, if a child of 13 years old is 105 kilos, it's a very big thing for the parents and for the child. So I did everything possible to lose weight, but all in vain. Nothing worked out. Doctors suggested some medicines back then, some shakes, something, but all were giving just past results, like losing 4 kilos, but gaining 6 kilos. So I decided, let me do it my way. I studied nutrition. I studied a lot about it. I started a diet which is sustainable, not just by eliminating foods, sugar, cut rice, cut roti, cut everything and then lose weight. Because how long can you cut all these things and just go on with life. So I started a sustainable diet. I added these things, and slowly and gradually, in 3 years, I lost 45 kilos. I
That's
touched
amazing. That deserves a
55 kilos. So that was my lightest, and 105 was my highest.
So how old were you when you actually started to lose weight?
I started losing weight when I was 17.
So that's really young. So you took control. You know, why I'm asking is because, as Dr. Ambrish says, it's also a very big brain decision, a mental decision. It's not just your stomach, you know. So you had that mental strength to start losing.
I was left with no option because I did everything that was available in the market. I tried those slimming belts. I had those medicines. I had those shakes. But what? It didn't work out. So dieting was the only solution, and it changed my life completely. I'm still maintaining the same weight from last, 8 years now? I lost 45 kilos 8 years back, and I'm still at the same weight. Why? Because I did it through a right diet, not through any medicines or something like those things.
That's amazing. You know, we'll have a private consultation straight after this.
For sure.
But I want to ask you before I come back to him for you know, detailed analysis of all the GLP-1 drugs, that if today you had that option to take Ozempic or Wegovy or any of these, would you do it? You know?
Never in any lifetime.
Okay, that's a strong statement in which to bring you in, sure. Doctor. So
no, I think, yeah, go ahead.
Yes, no, just
I think your story is very fascinating and it's very inspiring. But the truth is, if I were to ask people in this audience, how many people have struggled with their weight? How many people have tried to lose weight? And how many have done it successfully? And the last is, how many have held it even if they lost some weight? The truth is, we are dealing with people, we are dealing with not with such extraordinary examples. If you sit in my clinic at the Max Hospital in Delhi, one day, 9 out of 10 people who come are struggling with their weight. And they've tried and they lost 8 kilograms, 10 kilograms, became healthier, couldn't sustain the diet and went back again. So the understanding that obesity is a disease also comes from the fact that it is now understood that the brains of some people, not all, are wired differently. Their cravings are real. There is a food noise that happens in people's heads. And therefore, unless we...
I'm feeling so recognized and understood.
But that is true. It's true for many of us, you know. Yeah. So it is not physically possible for or mentally to apply that kind of discipline to really lose weight. So it's all very well to say that one can lose 45 kilograms, but that's one. And I think that these drugs have clearly addressed this problem in a very substantial way, and this is just the beginning. Now let me first add a point here, that these drugs were originally developed for diabetes, right? They are drugs which mimic the GLP-1 hormone, which is a gut hormone, and if you take these drugs, you will improve your metabolism in the sense that you will secrete better insulin and you will digest your food better. And these drugs have been around for 20 years. As the molecules were modified successively, these drugs don't just have an action on the pancreas. So GLP-1 is secreted from the gut. It's a hormone, it's a gut hormone. It goes to the pancreas, secretes insulin, helps you metabolize your food. But it also goes to the brain. And in brain, it tells you when to stop eating. Okay? And of course, reduces your appetite. Now, the problem is you can't use that GLP-1 externally because it just breaks down in the blood in 2 or 3 minutes. So scientists developed molecules that would not get broken down but have the action of GLP-1. And they kept improving on them till around 2015-16, they hit on this molecule called semaglutide, and then tirzepatide, and there are many, many more in the offing, which had a profound weight loss action, in the sense that the action on the brain was so significant that people were able to lose 15% of their baseline body weight, which was never seen before with any drug. Okay? Now, we are looking again at the weight. what are we doing at the same time? Their diabetes drastically improves. Even their drugs may go away sometimes, other drugs. Their risk of heart disease goes down by 20%. The risk of progression of kidney disease goes down by a similar number. Their fatty livers melt away. The fat is squeezed out of the liver. So you're not looking at just an obesity drug. You're looking at something that's treating a condition and preventing many, many complications. We have been using GLP-1 drugs, as I said, for 20 years for people with diabetes to reduce their complications. It's just that the newer molecules have such a profound weight loss action that the whole thing is twisted around to
a cosmetic. So I wanted to ask you, so at the level of medicine, I won't spend that much time because, if you have a diabetic condition and if there's a drug that can, really elevate those symptoms or even the condition itself, and if it then has some side effects, there's a trade-off, between the greater good. But when it is a cosmetic pill or injection that you want to take, that's when it becomes a much more important cultural conversation, So as you just said that the impact of this drug is that it imitates a hormone that your gut releases, but that it does in a natural setting, When you take this drug, a lot of people have said that they, in greater or lesser measure, their response is to feel nausea, to vomit, to see food. It's almost like induced bulimia, and to tell your brain that I just can't eat. Isn't that a worrying sort of phenomenon?
Well, that's how these drugs act. Maybe your brain is telling you to eat too much. And maybe you're getting that fixed. I'm just saying. So I'm not saying that these drugs should be used purely for cosmetic purposes. I think these drugs are very valuable tools for physicians to treat disorders, including the disorder we are calling obesity. So the question is that if someone is 4 kg overweight and wants to look better, and I keep getting these requests that I'm 55 kilograms and I want to be 52. So you're not a candidate for the drug, obviously. That's just plain stupid, actually. So the idea is that if your weight is causing you health issues, you're definitely a candidate for the drug. Of course, what has been said is these are not mutually exclusive things. For these drugs to work also, you need a lot of effort with lifestyle. You have to follow diet, you have to exercise, you have to do, those things are not going to go away. But despite that, and I'm certain in this audience, people will say, I've done everything, but my weight doesn't go down, and went down and came back up. That's when these drugs are indicated.
So I guess, we pitched this whole session as everything you need to know about this drug, and I'm going to pull you into this, Richa. But just, what are the downsides of this, doctor? Would you have to take it for life? Can you just take it for a short while? Does it rewire the chemistry of your brain? Of course, I'm not sure how many of the audience would know that, yes, there's a huge connection between your gut bacteria and your mental makeup. The ghrelin bacteria actually decides how your brain will react to food and things like that. So does it change the physiognomy of your brain if you take it for a couple of years, or does this have to be with you for life?
So let me first tell you the downsides of these medicines. Firstly, the upsides I've already told you. With the newer ones, you can lose more than 20% of your body weight, which is huge. For me, treating patients, that is a huge thing, a tool I did not have. We had lifestyle and we had bariatric surgery. And there was a huge gap between the two rocks, nothing in between. And that has been filled up. Now, but nothing, no drug can be there which doesn't have side effects. There is not a single drug developed. Aspirin you pop over the counter, you can die of a bleed from that. I'm just saying. Paracetamol, we pop like crazy all the time, can damage your liver. So every drug can have potential side effects. A drug is a drug is a drug. That's very clear. Now, what are the side effects? One are the acute side effects, which you mentioned. Some people feel very sick, nauseous, but aversion to food is part of this.
Is it natural to make you averse to eating?
Well,
not natural, I mean, this is induced, but is...
The thing is that you're eating too much. We are all, not you, I mean, we're all eating too much more than we need.
My eyes blinked rapidly.
Much more than we all do that. I mean, we'll walk out and we'll again eat all the, I went and had this new, what is this place? Ice cream while waiting in the afternoon. So I'm just saying that we all do that. So the temptation to eat is always there. So if you're cutting that out, so anyway, coming back to the side effects, the nausea is definitely nausea. reflux, rarely vomiting. Constipation and diarrhea with tirzepatide, for example, is not uncommon. All of these, fortunately, are transient. And they go away over a few weeks. So that is number one. Secondly, you must always start with a very low dose. And there are methods I have described in the book how to overcome these side effects. You know, what is the best way? There's no magic in overcoming the side effects. These are the short-term side effects. They don't bother us so much. If they're really bad, just give up the medicine. You know, the truth is...
Does it alter it in a way where it won't come back to...
No, the truth is that like every medicine, what happens to your thyroid medicine? What happens to your diabetes medicine? It works so long as you take it. So the sad reality is that they don't alter your system completely, that you're free. The fact is that, again, if you're using it to treat a condition, a disease, especially along with diabetes, diabetes medicines are lifelong medications. So some patients may need it lifelong. Those who have avoided bariatric surgery because of these drugs. Those who had very bad diabetes, they probably need to take it lifelong. The challenge is in the younger people who are resorting to these drugs or who may actually need it. In India, people get diabetes at 20, at 18 sometimes, at 25, and simply because of obesity. And they're struggling with their lifestyle, they have jobs in metros and they can't. So if you use these drugs for them, you can possibly help them lose weight significantly, control their diabetes, and they can maybe go off all drugs. But the truth is that if there's an underlying defect in some people, they will need the drug lifelong. But in one line, when you stop if you go cold turkey, you will put the weight back on slowly over the next 1 or 2 years. What we are trying to do is taper the medicine, and again, I've written how to do that, gradually, so that there is a weight loss phase. Okay, you have to lose 10 kg, you lost 10 kg, and then a weight maintenance phase, they come down to a very, very low dose of the drug. But again, I'll repeat, the drug works only as long as you take it.
So, when we're talking about the cosmetic aspects of this, and I'm going to bring Richa into the other systems in India that, very emphatically you say that it's not enough just to take the drugs. There has to be lifestyle changes as well. Yes. And a very crucial one in that is exercise. Yes. Because one other aspect of the drug is loss of muscle and possibly hair loss. So, for a cosmetic thing, that's a very big deal. But definitely muscle loss. And I know Karan Johar has said that he's not taken this at all, but there's been a lot of discussion around it because he looks very frail suddenly. Whether he's done it or not, I don't know. But it, in a way, brings forward there's this idea for Ozempic face and Ozempic butt and all of that. So for that, you anyway need yoga, resistance, gymming, weights, weight training.
And not so a very rapid weight loss will cause that. So you need to control that. You needn't go like that's why you need medical supervision. You need to adjust your dose. You need to adjust your diets, But one important point I'll make here, because it is a myth. The myth is that these drugs cause muscle loss. No. Whenever you lose weight, you lose muscle also. If you lose weight drastically by a starvation diet, if you lose weight drastically by bariatrics, using bariatric surgery, you will lose muscle also. The drugs do not have any adverse impact on muscle. It's not a drug effect, it's a weight loss effect. That's why when any weight loss program should have built-in strength training. Otherwise, let's say you lose 10 kilograms. In that, you lose 2 kg muscle, let's say, approximately, okay? 2 kg. Now, then you say, I give up the drug or give up the diet and I come back. You put on that 10 kg again. What you regain is not muscle, mostly fat. So if you do 3 or 4 cycles of that, so much of your muscle is gone. Right. So that's why I insist that it is part of a program and not a standalone. The problem with these drugs is that people start losing weight anyway. So I've had patients only recently again telling me, my weight is going down. Why are you so worried? I don't want to exercise. I don't want to do this. But I'm already losing weight, which was your goal. So why are you worried about it? So that is the wrong concept, and we need to fight that.
Right. So, Richa, I want to come to you that when you dived into, like you said, take control of your own life, were there Ayurvedic systems, yoga, some of the traditional, very deeply holistic, natural systems that you went to or that helped you?
Not the yoga. I didn't started yoga back then, but yes, I surely joined a gym. I started my workouts because that keeps me going. Like, I stay calm when I work out. I stay calm when I do diet. It's like a therapy. So no, not yoga for sure, but yes, I did my exercise, I did join the gym, I did hit the gym every single day, despite whatever is happening in the life.
So, in this 45 kilo loss that you did, apparently there was a phase when you lost 7 kilos in 21 days and you lost 3 inches. That sounds like Ozempic on steroids, So how did you do that? And did that make you ill? Did that make you throw up? Were you depressed? Were you irritable?
So no, see, as Sir said, that many clients do come to him and saying that we are not losing weight, why we are not losing weight, despite doing everything. Same thing happens with me. Every single day I'm meeting hundreds of people saying the same story again and again. But again, I have seen, not just seen, I have transformed 50,000 plus people with just the diet.
50,000?
50,000. And they were like not having kids, going through IVF solution, depression, anxiety, what not. But yes, diet did work wonderfully for them. It worked wonderfully for me. Like you just asked me, you lost 7. It was 5 months back when I went for a vacation. I did indulge myself in some extraordinary treats, so I gained 8 kilos. And weight is something I don't tolerate. So I came back, I started an intermittent fasting diet. I am doing intermittent fasting on and off. And yes, I did lose 7 kilos in 21 days, 3 inches from my waist, not by starving, by eating every single thing, you name it. I eat my rice, I eat my roti, I have 2 cups of tea with sugar in it. And I think that is the right kind of diet you should follow.
I think what Dr. Ambrish is saying is just an extraordinary case, I don't think we
I
should
have
listen
seen
to you.
extraordinary cases, not just me, I would say, because it took me 3 years to lose 45 kilos. It was not just overnight, but yes, I have seen my clients losing tremendous amount of weight, where they struggle to lose weight with like 7 years, 4 years, they struggle to get their periods, the skin issues, their gut issues and everything. But I believe a good diet, a healthy relationship with food can change so many things in your life.
No, but are you categorically saying that you have cups of sugar, tea with sugar in it? Like you've not cut sugar out?
Yes, see, I believe in sustainable changes. That's what I just said. Why you want to make such promises that you cannot keep in next 5 years? Okay, a dietitian asks you to cut wheat, cut rice, cut sugar. You do it like half-heartedly just because you want to lose weight, but you cannot promise those things for like rest of your life. And what happened? The weight will come back.
So is it just that what is yours, if you were to share, with the audience, say 2 or 3 key things that are part of your nutritional plan, what are they? Is it just small amounts, intermittent fasting, 1 meal a day? What is it that you think works for your clients and you?
Always choose seasonal, local, available things. Don't go for your organic, your super highly expensive things that you cannot follow. Second, prioritize protein in your every meal. Your every meal should have some amount of protein. Be you are a vegetarian, you are a vegan, you are a non-vegetarian, anything that you like. Number 3, don't just think that carbs are your enemy. Stop thinking like that. Your mind, your whole body needs carbs. Rice, roti. We, as an Indian, are used to eating carbs. We have grown eating carbs. So just add little by little of it in your diet. Small portions. Intermittent fasting works wonders. Yes, you can try. If it works for you, go for it. But I won't say every diet is for every person. Analyze what is for you and do it accordingly.
Right. So, I'd like to come back to you here that with the Ozempic, is it that you can then go ahead and have your dessert and have your ice cream and all of that, or is it that you're now going to have a reaction where you can't eat it?
So GLP-1 drugs tell you how to eat. because you'll not be able to eat excessively. So if you're practicing intermittent fasting,
can
and
you eat a
fasted
little
all
bit, or
day,
you'll see a
of
cake
course
and you'll throw up?
It's very variable. it's very variable.
You can see how personally urgent this is.
Hugely variable, and there are two kinds of reactions people have told me. One is that everything is fantastic; they don't feel the cravings anymore, the food noise is gone. But there is a small proportion that says exactly what you're hinting at, which is, I don't enjoy food anymore. What's life all about? So those things are, there is a lot of difference. I have patients who've lost 3 kilograms, patients who've lost 35 kilograms. So there is a lot of individual variation, but we cannot downplay the scientific advance that has happened. We also cannot downplay that research the world over has shown that losing weight just by diet and exercise, again, she's an exception and I admire her and it's very inspiring. Research has clearly shown that by diet and exercise alone, once you put on that weight and you are 50 years old, it's not going to be easy to lose it and sustain it. It's very, very difficult. It's not that simple. It's not a one-line answer. And if you're doing another job, if you have a profession and you're working and then you're looking after yourself, and it's a big challenge. This is worldwide. Now, if there is such good data, I would suggest that Richa write it up. This would go in Nature or Science or any amazing journal, because you have obviously cracked the code which no one knows. So it's the truth. All I'm saying is I'm not a nutritionist. I'm an endocrinologist. I deal with disorders. I have done some studies. I have read thousands of studies, okay? And that is all distilled for public in this little book that I've written, which is it's a simple, light book. But the fact is that we can't take away the science. And the science tells us that this is a phenomenon that happens. And the science is based on 1,000 people following a particular program, 1,000 people not following a particular program. What happens to them later on? So those kind of things are important, that we shouldn't diss the science. This is very typical Indian thing. As we were talking of scientific attitude, we might say that Ayurveda, as people tell me, or yoga has the answer to everything. They're great things. They don't have the answer to everything. Okay? So the fact is that the science behind these drugs, the evidence, the trials are very strong. Now, unless we discover some hidden side effect, which is always possible, I can never deny that. You discover side effects of metformin after 60 years of use, then it's a different story. But since the pipeline is so strong and so many new drugs, oral drugs are coming out, so many things are coming out, I genuinely feel that this class of drugs has changed the way we practice metabolic medicine and will change it more and more. Endocrinology, metabolism, diabetes, obesity, even heart disease, fatty liver, all those things. We didn't have these tools. So it's not that we are jumping to prescribe medicine. You should come and listen to the amount of time doctors try to explain about diet, this. They often have nutritionists as part of the team, maybe not as good as her, but definitely nutritionists who are spending time and explaining the diet. I mean, it works for some people. Again, there are some people, I have so many examples of people who did amazingly well with diet.
So is this contraindicated for anybody?
Yes, of course.
Of course, if you have cancer, and not the extreme cases, but
so if you have a history of pancreatitis, you shouldn't take it. If you have a family history of thyroid cancer, you shouldn't take it. If you're already frail at 75 years old, and you don't have much muscle mass, and I'm not talking obesity here, but I'm talking of diabetes management, I would not use it. If you have already got a huge tendency to throw up, and always, some people have a very severe reflux problems, you're not a great candidate for the drug. Or if you're completely not willing to exercise or follow, then I think you should still avoid it, because it is going to be a problem. You will get results immediately, but then later on, you will end up in trouble.
So let me ask you something specific, and then we'll stop for a break, is that, if you have this drug and you don't exercise, because the original problem began because you can't have mental control, that you're not able to control your diet, you're not able to go to the gym, you're not able to have a lifestyle change. But you're saying that the companion of this drug is a lifestyle change. So
absolutely, and what I've seen, Shoma, is that once people start getting results from their efforts, the motivation is great. So it changes a lot. Most people, when they start losing weight, for whatever reason, whether they're on the drug or whatever, then they get inspired to do more and more. and they feel that now I can manage, because they were making that effort earlier and it wasn't working. Maybe they weren't guided well enough, but whatever it was, and now it's working. So I find that overall lifestyle compliance after some weight loss with these drugs is much better than it is when you're completely frustrated. You have tried 20 times and it doesn't work. All kinds of diets.
So final question is that there's no harmful sort of side effect as of now, as you know it, that if it is creating a sense of satiety, it is having a delayed sort of digestion, so your stomach feels full, it's changing the impulses of your brain, the signals are changing, all of that. Let's assume you're on this ride and then you suddenly realize that you don't like it, you don't want to do it. When you get off it, will you come back to your normal physiology, or will there be some changes?
At the moment, it seems, as I said, they work only till you take them. So not just the benefit, but also if there's any adverse impact, that will also stop the moment you stop taking them. So I think that's important to understand. But again, one small point, I know we're running out of time. One is that as far as the brain action is concerned, Alzheimer's is the next study. I mean, the major studies now are on cognitive dysfunction and Alzheimer's. 20% of the American population has been exposed to these drugs already. So Americans go overboard about everything, so I'm not saying that's right, but I'm just saying that's how it is. So I think the important thing for a country like ours is to recognize them as medication, use them judiciously, under medical supervision, and those who require it, and they certainly will offer you, a certain tool which was not existing. But one last line about long-term side effects. So one is you spoke about muscle loss, which is not because of the drug, but it happens because you lose weight rapidly. Ozempic face is what? You lose weight rapidly, the skin sags here, that's Ozempic face. Ozempic butt, all kinds of things are coming out. Hands, someone posted a picture of Ozempic hands. So the other important part is, what are we worried in the long term? One is, whenever we lose weight rapidly, again, gallbladder stones risk goes up, right? The one long-term side effect that is, it's not a side effect. A long-term observation has been that some people develop eye complications. Now that's exceedingly rare and unproven, but we have flagged that. Everyone has flagged that, and we're going to observe any such thing happens. Any medicine you take, if it has a side effect 1 in 1,000, that is not regarded as significant to stop using the drug or reduce the use. You just try to identify who's that 1 in 1,000 is going to get it, and don't prescribe it to that. So the only ones that are unexpected, I would say, are the eye ones, which are, one study shows they're there, other study shows they're not there. So it's in a flux, and in any case, even if they are there, they're exceedingly rare.
So just to final, the shift in lens is that now that these drugs are available, and you're saying, of course, they're quite expensive right now, but they're going to get cheaper.
Yes, they will.
You're saying it's going to be the GLP-1 decade, literally.
Yes, 100%.
So, but you're saying the lens is shifted now so that you wouldn't recommend this as a cosmetic device, but you're saying people should lose weight because it's a health risk. And if you're not already having obesity-related diseases, you could have them, and that's why it's important to take Ozempic. Is that what you're saying?
Absolutely, you've hit the nail on the head. Endocrinologists have always looked at obesity as a medical condition. The problem is that this drug gets hijacked by cosmetic sort of clinics or whatever. I have nothing against if they are qualified to do that, but I can see that already happening. And while it is technically, theoretically, all only on prescription, I'm scared that regulation in our country, especially in the smaller cities, and as far away you get from the main cities, the regulation may not be that tight in many parts of the country. So that bothers me a lot. So I think it's very important that these drugs are treated as drugs and prescribed properly, so that what happens is, if a drug is used by people who don't need it, then random side effects appear. The drug gets a bad name, and then the people who need it, they refuse to take it. That's a very common problem. Like statins, people refuse to take them even though they need them. So anyway.
Somebody wanted to ask a question.
At the moment, ma'am, the injection is clearly more effective. But there's no comparison. But tablet is good, of course. Tablet is used primarily for managing diabetes, not for weight loss. A bit of weight loss is an added sort of spin, but it's not much. The injections are clearly once a week. But let me tell you again, there is a once a month injection in the pipeline. There are pills that will match up to the injection that are in the pipeline. There are molecules that will preserve your muscle along with this. So you will have, even if you're losing weight by any other mechanism, you'll be able to preserve your muscle by certain drugs. So it's a field where almost every month there is, or even every week I can say, there is some significant advance.
You know,
so it's not the last that we are hearing.
So doctor, this is not, I'm just on a more, maybe on a light note, maybe not. I'd once asked Sarva Priyananda, who's Swami Sarva Priyananda, who's a Vedanta master, and because, you know, psychedelics also sometimes creates, or equivalently creates spiritual experiences. And I had asked him then, what's the difference between, say, a transcendental meditative experience and a psychedelic experience? And he said, those who take psychedelics can, yes, access that dimension, but a fool who takes a psychedelic will come back and remain a fool. But someone who meditates will transform and be a different and evolved human being. So is there a little bit of that here, that if we take this drug and we lose weight, the great thing we have is this relationship with ourselves and our brains and our attitudes and our, you know, lifestyle choices, that we are basically hacking through that and we're taking a quick pill and we'll remain the kind of flabby fools we are.
So it's not a crutch. The medicine is not a crutch. It's a tool. It's an aid to assist you in your ride towards good health. And if weight is the reason for your poor health or your long-term outcomes that could be poorer, then we have tools now to address it more than just lifestyle.
Right.
That's the way.
Okay. And last question, can children take it or is it contraindicated?
At the moment, no. In the West, it's approved though. It's approved for people over 12. I'm wary of that. And fortunately, our government hasn't approved it for children yet. So the older ones we use in kids. The earlier GLP-1 just cause 3-4 kg weight loss, you know, that kind of thing is okay. But the newer ones, I think we have to be cautious. At the moment, I would not recommend for children.